Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan. I'd like to talk a little bit today about the relationship between orthodontics and gum situations. So we often see gum swelling with orthodontic treatment. Well, why do we do that? Because when you have braces on the teeth like this, the teeth are more difficult to clean. Bacteria tend to accumulate on the teeth, more difficult to remove because of the appliances, and those bacteria cause irritation, inflammation of the gum tissue, cause the gum tissue to swell. That swelling then causes more food particles and bacteria to be trapped, and it becomes kind of a vicious cycle. And actually it's very unhealthy because those same bacteria that cause swelling actually can cause bone loss and gum disease. Also, the appliances themselves can be in contact with the gum tissue and irritate it further. Also, the swollen, thickened gum tissue makes it much more difficult to move the teeth orthodontically. So what we do in these cases is we reshape that tissue, we remove that tissue, and teach the patient how to clean very thoroughly to minimize the chance of that tissue coming back. Now, it's very interesting because paradoxically, orthodontics can cause swelling, enlargement, inflammation of the gum tissue. But on the other hand, just the opposite, it can also cause recession of the gum tissue. So I want to show you a slide of gum recession caused by orthodontics. And as you can see here, there's a tremendous amount of gum recession. Why do we have gum recession with orthodontic treatment sometimes? Well, sometimes when those teeth are moved, they're moved through the bone, and the gum tissue thins out dramatically when those teeth are moved out. So that thick gum tissue now becomes thinner when the teeth are sort of moved into it and sometimes out of the bone slightly. That thin gum tissue is very, very susceptible to recession, brushing too often or too hard, or simply lack of proper blood supply to the thin gum tissue. So in those cases, we can see recession, and you can see this recession is very significant. A gum graft was done here somewhere else, and it wasn't very effective at all. So we treated this with a pinhole technique, and we were able to get that recession taken care of and treated. The patient was delighted. The recession was taken care of. We taught them how to brush carefully and resolve the problem. So we work closely with many orthodontists, but sometimes these things can happen, not the fault of the orthodontist, it just can happen in some situations, but there's ways to treat it and correct it. So remember, have a healthy mouth, have a healthy life. If I can help you in any way, I'm here.